Hello guys, I hope all of you are doing well, and this is a small video just to let you guys know how I have designed this workbook to cover entire pharmacology in around 50 to 55 pages in a one-day revision class which is scheduled on 31st of October in Hyderabad. So let me just give you a glimpse of the workbook guys. First of all, in 50 to 55 pages we'll cover entire theory divided into different topics like G Pharma, ANS. So I'll just show you how am I going to cover. So, I cannot write everything in this one day class because of that I have to use a workbook. So, introduction parts I've already written here about the introduction part, like the definitions, route of drug administration, which are not much important. What is more important is pharmacokinetics. So, pharmacokinetics will be covering in 2 pages. So, this is first and this is the second page of pharmacokinetics. So, whatever is important, like absorption, distribution, right? The Henderson-Hasselbalch equation, even bioavailability, the curve. And you can see here, everywhere I have left these gaps where I'll make you write what are the important points. So basically, I'll ask you to recall. So anybody who has already revised can actively recall and participate. And if somebody has not even started with pharma, guys, believe me, I'll give you the entire pharma in 50 to 55 pages in such a way I'll explain you so that your job is done, right? So it'll help you for revision. And even if you have not done pharma, it's going to help you. Now, the other parts here like pharmacokinetics, metabolism, excretion in the form of this workbook. I'm going to cover pharmacodynamics. We're going to cover the DRC, drug receptor interaction, and all these graphs I've already pre-made here. And I've left whatever it is important, clinical pharmacology, drug schedules, pregnancy drug category, clinical trial, TDM, pharmacogenetics. So everything I have already pre-written here, but I've left many blanks which you have to fill up or we together will fill up so that you get chance to recall as well. Right. So you know that, I mean, this is a one day class, so I cannot write everything. Time is less, right? And then I have given some areas for notes as well. So if I write something, we write something else, or later on you want to add something to these revision notes, you can do that. So I've given you adequate ample amount of space for notes. Similarly, you're going to cover autonomic nervous system, like parasympathomimetics, parasympatholytics. Then we can cover sympathomimetics in one page. You can see the entire classification of sympathomimetics, which is a very big classification. The direct acting, indirect acting, mixed acting, and I've left here these spaces here, so they will cover up later, right? So sympathomimetics we are going to cover in one page, sympatholytics in one page. So by doing that, in around 5 pages will be done with autonomic nervous system, and again the notes they come. So similarly guys, I'm going to cover the entire pharma. This is your cardiovascular system. Then I'm going to cover the kidney, central nervous system. This is, you can see, anti-epileptics. We'll discuss in one page, only one page, everything about epilepsy. So similarly, I'm going to cover entire pharma. And then when I come towards the last of the workbook, like once you're done with REST, PGID, etc., I've given you a couple of pages here of images, right? Whatever are the important images in pharma? I'll give you two to three pages which can be asked. New drugs. So in 2 pages, I've given you, we'll discuss all the new drugs which have been approved in last 2 to 3 years, which are important for your exams. And finally, the last thing is drug of choice. I've even given you a table of drug of choice here, alphabetically, right, in 5 to 6 pages. All these drugs of choice, it'll help you to revise. I'll tell you how to revise these drugs of choice so that by the time of exam, you retain everything. And finally, at last, we'll end with drug toxicity and treatment. I've created a separate table for that, where you have the antidotes of choice and dialysis, where do I do dialysis, or where I don't do dialysis is not done for. So overall, this is one hell of a package of a workbook where we'll be able to cover the most important things in pharma. So I'm telling you, we'll be covering 90% of whatever I cover in a 5 days face-to-face offline class that I'm going to cover in just one day. And how am I going to that make possible is because we will have this workbook with us. So the colored printed workbook is what everyone is going to get. And what this will make us easier is that in one day we can cruise through the entire topic. So it's a one day class, so I cannot write everything, but certainly I'll write something which will make it interesting. So looking forward to see all of you guys in Hyderabad on 31st of October. Bye bye. See you there.